Hello, everyone. This is Siddharth Dahmer. Welcome to our webinar today on GoodFxn, our new functional medicine program. Okay, great. Well, let's get started. So, thank you, everyone, for coming in. So, what if? What if you could reduce your pain, lose weight, improve your function with conservative, low-risk methods? So traditional medicine has its role. Regenerative medicine, which is a large part of what I do as well, also has its role. Exercise and physical therapy has its role as well. But what else can you do to improve your quality of life and function? So everybody that I see really asks these questions, including what can I do to get better? What should I be eating? And what supplements should I be taking? Incredibly common questions. And I have traditionally given some relatively general answers as to what I think is helpful and would be useful. But the questions and the answers I've had in the past regarding some general nutritional guidance, supplement guidance, and even referring out to nutritionists has been relatively inadequate, in my opinion, and hasn't really been able to, I think, add enough value. And so I've spent a lot of time in the last several months of trying to figure out how to offer people a better solution for these kind of issues so that they can do better, lower risk, and get better results for what we're trying to do. So GoodFxn is the name of our functional medicine solution for inflammation, pain, and weight gain. It fills in the gap that really everyone is looking for. And it's an advanced scientific nutrition and lifestyle guidance, which I think gets us to what people are really looking for, which is how they can make meaningful changes in their own life in ways that can have a profound impact in their quality of life. So my background, I think most people who are currently on this webinar already know who I am, but in case anyone who does not, my name is Siddharth Dahmer, physician, Chicago Arthritis and Regenerative Medicine. We're focused on musculoskeletal conditions, mainly utilizing regenerative medicine treatments for osteoarthritis, tendonitis, and back pain, and utilizing traditional rheumatology treatments for inflammatory arthritis or autoimmune arthritis conditions. So again, that common question that I get, what can I do? Doctor, what can I do to get better? Is what's really driving this whole new program. So what is functional medicine? Functional medicine is essentially an approach to medicine that identifies and addresses the root cause of disease. It's different than traditional medicine, which frequently is treating just what is the actual pathology and symptoms. It has a little different approach, which I think is very beneficial for people when they're really trying to get better overall long-term. Helps to figure out the origin of pathology, and it's creating solutions based on addressing the root cause of the problems. So it's different. There's a preventative aspect to things, and frequently there is a deeper aspect to things of how you want to treat an issue. So this is a really interesting and great phrase and figure that I saw from the Institute of Functional Medicine. One condition, many causes, one cause, many conditions. It's a different mindset for how you look at what people are dealing with in life. So the example for the Institute of Functional Medicine was they looked at depression and said, look at all of these different things that are going on, one condition, but many different causes. On the other end, here's one cause, meaning inflammation, that leads to many other conditions. And this is really an intuitive way to understand what functional medicine is about, which is taking something like one condition, let's say depression, and then looking at all the other things that could be driving it and treating those things, or looking at one big problem such as inflammation and then making sure you're treating that because of everything else that it connects to. It's different than typical medicine. So when I think of musculoskeletal pain, I think of this as there's really three main things that are going on. There's an issue of stability, there's an issue of inflammation, and then there's an issue of neurologic issues that drive pain as well. Super key, because if you want to get somebody the best possible result, you have to hit every single one of those aspects of their condition. And if you do, you get a much better result in terms of pain and functional improvement. And what's interesting is that functional medicine does offer us benefit here, certainly in terms of reducing inflammation. It has the potential to improve stability by strengthening some tissues and even on the neurologic end as well. And so I'm excited for adding this component to what we're able to help patients with, because I think it does help with all of those issues. So really great question is, how is functional medicine complementary to traditional medicine? And I think of this in a few different ways. For my patients who have chronic inflammation from an autoimmune condition, functional medicine can and does help control inflammation, helps to improve persistent symptoms that a lot of folks with autoimmune conditions have, meaning pain and fatigue. It is complementary to the traditional treatments that are utilized. Does not necessarily mean that you can't utilize those treatments. It's complementary. And it does help people reduce their reliance on pain medications, which has so many benefits long-term as well. Whether that is reducing potential for side effects, whether that is reducing the reliance on sometimes overly strong medications like narcotic pain medications. There's just a lot of benefits to finding alternative ways to control a lot of these chronic inflammatory symptoms. So another way to look at functional medicine is how is it complementary to regenerative medicine? Again, regenerative medicine is a process of utilizing your own cells, platelets, and blood, as well as bone marrow stem cells to treat orthopedic conditions. Well, functional medicine helps with weight loss. Again, it helps to reduce inflammation, and it helps to improve function and activity. All things that are complementary and beneficial to regenerative medicine. And again, I think a really great add-on and additional benefit that our folks who are getting these treatments can receive as well. You know, I have this is sort of my general approach to regenerative medicine, where we look at someone who has pain leading to reduction in activity, capabilities, and quality of life, and then utilizing treatments like prolotherapy, platelet-rich plasma, and stem cells to help treat arthritis, tendinitis, injuries, and back pain, leading to a better quality of life, optimized wellness, reduced pain, healthier life. What I like about the functional medicine component is that it focuses on the optimized wellness component, it focuses on the inflammation component, all things that really fit very well in this overall process. And I think will help our patients really kind of improve to the next level. So GoodFxn, that's the name of our functional medicine program here. Focus on inflammation and musculoskeletal health. Focus on that because that's really the kind of patients that we see. That's who already trusts us, and that's what we're focused on. So I spend a lot of time looking into this and trying to develop a plan as well as a safe and scientifically appropriate way to do this. And I've developed a collaboration with an organization called Revitalize Health. They are one of the leaders in functional medicine. They're currently working with quite a few clinics around the country, about 150 clinics, to offer functional medicine program. And they offer an approach that is personalized as well as a dedicated functional medicine program. And in the program that we've created with them, I think it's going to do the right way to do this, which is instead of a one-size-fits-all perspective, it's very much a personalized and individualized approach to doing this, very much tailored to your needs. What I like about this is, number one, Revitalize Health has a wealth of experience and has been doing this for many years. And their experience with being able to do this with so many other clinics is evidence to me that they have a solution that works. And the fact that they were really recommended to me by two of my colleagues who've worked with them personally and closely says a lot to me as well. And I like the fact that they have that depth of experience and breadth of experience with different clinics to offer this kind of approach for us. Yes, somebody just asked, how about some specifics? We're getting to specifics, of course. So GoodFxn has a 3-month program that's focused on nutritional and lifestyle improvements, supplements, a gut health and detox program, mindset, and exercise principles. All the things that literally all my patients are asking about. The results that you should expect are an improvement in pain, increase in weight loss, improved fatigue and energy, improved mental clarity, as well as better function. What's nice about this program is that, number one, it's at your pace. It's an online material where you have access to their patient education portal at any time. What's really nice is that there's a lot of accountability with this. To begin with, there's a dedicated live coaching sessions. You have a dedicated coach that you work with as well. There's an automated program reminders to keep you on track and accountability checkpoints for missed coursework as well. So it really keeps you on track for getting through this. So it's not just a data dump of information, but rather it's really a guided process with a health coach to get you through this process, to learn, and to actually institute the changes as well. It's one thing to say, here's the right way to do it. It helps to have guidance and a coach to actually get through that process as well, so that you're not only staying with it, but that you're also actually completing the program as well. The gut detox part of the portion is really a key part of this. Again, to me, this is in large part why I think functional medicine has a great deal of value. It's a 2-month guided process with your health coach. It's essentially making significant dietary changes, specific supplement regimen to help reset and restore your gut system. Starts with an elimination diet to initially reset the gut, and then reintroduction of foods to rebuild and strengthen your gut health. It's very much tailored to your health needs, and again, with specific gut detox supplements to aid in the process. Supplements that are utilized come from a company called Zymogen. These are really very much a premium and professional grade nutritional supplements. They're pharmacy grade, that's higher quality than what you can get over the counter, and they're actually available only to MDs only, which is why we're offering this, because of the quality of what's being offered. They're designed specifically to assist in gut repair and detoxification, which then offers antioxidant, anti-inflammatory support. GoodFxn has a ton of other supplemental resources and program experiences, whether that is actually the shopping tutorial, cooking tutorial, exercise demonstrations. They have a whole emphasis on juicing classes, fermented foods, expanded recipes, meal plans, and shopping lists. They've got recommendations when it comes to pre-made foods if needed, and a lot more educational documents as well. I think the program is not only educational, but really does instill a lot of accountability as well. I really think that the challenge that a lot of people have with making the right kind of nutritional changes is, number one, just getting the educational information on it. But number two, it's hard to stick with it. An elimination diet is not easy. And guiding through that and doing it in a safe and functional way is not easy either. What I like about what this program is offering is will be able to do it in a way that will be able to get you to a successful outcome. Not only in terms of getting through the actual process of doing this, that kind of gut detox, but actually getting a better kind of result as well. So it's not only an educational process, there's also a ton of accountability as well, which is what I'm really excited about. Any questions thus far? Somebody was asking for more specifics. The program is very much based on your specific needs. There isn't a one-size-fits-all process. As an example, I am personally a vegan, and that works for me. That may not work for somebody else. And a program works if the principles are sound, and if you can suit it to somebody who has specific nutritional specifications. And what works for me based on my genetics and personal preferences may not work for somebody else. And so the program is very much based on being able to adapt to your own needs as well as your own specifications. A program that is too general and sort of demands that you do it X, Y, and Z has limitations, because the reality is your genetic background may not be the same or fit the same profile as somebody who has a different genetic background. And to kind of pigeonhole people into a specific way of doing things, which frankly is how a lot of nutritional guidance comes, is not the right way to do it, because it doesn't take into consideration what actually works for you. Somebody else asked about a very specific hip issue that they have and wanted to know about nutritional guidance for that. I think the way to think about joint pains and nutritional guidance is a couple of things. Number one is it a matter of reducing inflammation? Because there's certainly an elimination diet and then reintroducing foods that are appropriate to you. That would make sense. There's certainly weight loss consideration if that's an issue. The more weight you can reduce, the better hip, knee, and ankles damage can get. If it's a matter of trying to develop more strength, that's a different nutritional approach as well. And then lastly, if it's a matter of supplements, there's a classic supplements like glucosamine, omega-3, and turmeric, curcumin. But then there's certainly other gut-specific kind of issues as well that can help from an inflammation standpoint when it comes to supplements. So it very much depends on what the perspective and angle is, depending on your specific issue. The program that we have, this is a new program for us, but it's not a new program for Revitalize Health. The normal cost for this 3-month program, plus the health coach, plus the detox supplements, is it's about $41.90. Because this is a new program for our patients, we're essentially cutting the price down by 50% and charging $19.95. It's going to be good for the first 9 patients that we have for this, 9 clients that we have for this, in large part because we want to get a lot of quick feedback. And as someone who's sort of a founding member, we'd like to obviously respect that and give people a discount to get into this relatively quickly. If this makes sense for you, if you'd like to learn more, you can email us, or alternatively, there should be a link that pops up on your screen now. If you click there, essentially, if you email us, that link right there will take you to our Contact Us page. And you can either go through there, or you can email us directly at admin@chicagoarthritis.com. and just type in the subject line or the body of the message, Good Function. Obviously, write down your name and contact information, and we'll get back to you to help you out with that offer. Well, wonderful. I appreciate everyone's time today, and I appreciate the flexibility regarding our start time today. And I'm super excited about what this new functional medicine program is going to develop into and what it also offers right now. And if anyone has any other questions, I'll leave this open for like another minute or two. If you want to leave questions via chat, that's fine. Or if you want to email us at admin@chicagoarthritis.com, that would be great as well. And if there's no other questions, I'll sign off, but I'll give it maybe 30 more seconds to see if anyone else has anything else. Okay, great. Well, thank you everyone for your time. And until we connect again, have a good day and live well. Bye-bye.